Hello, I'm Lori Steiner. Welcome to Golden Opportunities.
Today, getting your back in shape. We'll resolve to share options for improvement. Then we'll run the numbers on the status of the stock market. How healthy is your health insurance? We'll check up on how your policy checks out. Plus, beating breast cancer. We'll identify important steps for identifying it early. And a little-known strategy to stretch your Social Security benefits.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Is your back giving you a sign that your spine has taken a detour towards discomfort? Maybe you've had to yield to pain or even stop your daily activities. Dr. Noel Aboud is here with a green light to get you going on the road to recovery. Dr. Aboud is with the Solon Spine and Wellness Center. Welcome back to the show.
Thank you.
Now, our bodies were designed to go, 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 go. So how does our spine factor into that kind of forward motion?
Well, we have a saying in our office, and it says that stiff is old and flexible is young. So we wanted to introduce movement wherever we can into the spine, because the more you move, the more you prevent degenerative process or decay in your spine.
Okay. So there's active tissue that needs that movement, huh?
Exactly. The cartilage, the disc that's between the vertebrae, that is active tissue, and that's what some of the newest research has shown. So what that means is that disc can repair itself to some degree. And when you have a long-standing injury, for example, maybe through a car crash or a work injury, or you had a job where you stood on your feet for 20 years, what happens is the vertebrae stop moving independently, and the disc no longer gets blood, because the only way the disc gets blood is through movement. So if we're not moving, or we're sedentary, or we're sitting on the couch, our discs are beginning to decay.
They get dried out?
Exactly.
So.
Just like a piece of toast left on the counter overnight. It dries out and it breaks and it becomes desiccated. And that's a term that they'll see on the MRIs oftentimes.
How do we fix it?
Well, first you got to discover what it is. I mean, it may be called stenosis, it may be called herniation or bulging, but typically you see these people walking in the grocery store bent over, leaning on the cart, or they can't walk very far. Those are the classic situations of this disc decay.
Those are the symptoms you're looking for. So.
Yeah, that's part of it, and we want to review the MRI. But what's amazing is a new technology. It's called the NDS method, no disc surgery. And what it entails is a specialized machine that creates like a vacuum or a weightlessness, and it draws blood into that disc. And once the blood comes in, the disc can begin to repair itself and heal. Okay,
so, but, I mean, that's a great, procedure, technique, whatever, but if you're in pain, you don't want to move. So
right, it becomes a vicious cycle, because if we ask our patients to move and stay active, but they can't. So what this specialized table does, it will move that disc for you. It creates a pump. There's a certain pump that keeps the fluid going, and this will allow you to heal while you're laying on our table.
So you don't really have to move a whole lot, like get out there and exercise.
Temporarily, but we eventually, as you begin to improve, we'll be forcing you to move.
Want you to get back
Correct.
out there.
And the average patient, of course, wants to move. And one of the last things that you want to do, you could sit around all day on a Sunday and you feel like the last thing I want to do is get off this couch, but once you start moving, typically you'll feel better.
It's the inertia that keeps you there. Once you get past that, it feels good, probably.
It really does. And we were created to be moving. We weren't created to be sedentary creatures.
So that movement gets the blood flowing, gets the nutrients going, gets the discs regenerated, so that you can do all the movement that you're supposed to be able to do as a human.
Right, and that's what we do typically, is we'll schedule an hour together where we'll sit knee to knee with the patient. I want to maybe review their x-rays or MRIs, and I want to hear about their past, and I'll have a lot of questions, and I'll feel their spine. And at that point, I'll be able to let that patient know, yes, you qualify for this new procedure, and no, you don't. And then if they do, we'd sit down and make a plan. But we've had great success with those patients we've accepted.
That's fantastic. It's great information. Do you have a bottleneck in your back? Follow Dr. Aboud's directions to get things flowing smoothly again. To sign up for his help, give him a call. The number is next.
Find out more by calling Solon Spine and Wellness Center at 440-941-9331 or log on to www.solonbackpain.com. Next, to market.